Afternoon, YouTube. Welcome back to my channel. In today's video, I'm going to discuss paid in full, the LPN or LVN, depending on what state you live in. In the dialysis setting governed by the Board of Nursing, LPNs and LVNs are able to work in dialysis. I live in North Carolina, so one of the duties that LPNs can do in my state is that LPNs can pass medications in the state that I live in. So dialysis providers sometimes will hire an LPN to work as an LPN in the dialysis setting. Usually, they're going to be passing meds, and they'll usually have a section, as a PCT would have a section. They'll put patients on, monitor patients, take patients off the dialysis machine, and they're going to be paid more than more than a PCT, but they're not going to make as much as an RN, because one of the huge differences from an RN to an LPN in North Carolina is going to be the ability to provide assessments. This is based on the Board of Nursing. Based on the Board of Nursing for North Carolina, LPNs cannot provide assessments in practically any setting. You know, maybe in a nursing home setting, they possibly can. But in a dialysis setting, if an LPN does an assessment, it has to be signed off by an RN. So because it's a little cumbersome with signatures and that sort of thing, they typically are going to be able to pass meds, and that helps out the RN on duty a lot. And they're basically working under an RN, you know. So there is a need for LPNs in dialysis, not as much as RNs, because they can't really run the floor. They're capable of running the floor, but because of their license and the restrictions to their license, they can't run the floor like an RN could run the floor in North Carolina. And I'm going to say probably in all 50 states, LPNs probably don't have that ability in a dialysis setting. Is that to say, hey, there's no reason for me to become an LPN because there's no place for me to work? That's not true. LPNs are needed in dialysis because you will probably, if you're hired, you're going to be doing the job of a PCT, but you're going to get more money than a PCT would make. And there are some positions where they're asking for an LPN. So the LPN can be an assistance to the nurse as far as doing the medications, helping run the treatment. So there is a need for LPNs in dialysis, but not as much as an RN. So what would be the benefit of an LPN going to school to get her license and then wanting to work in dialysis? Both dialysis providers that we have in North Carolina, the two larger ones, Fresenius and DaVita, help the LPN go back to school to obtain her RN license. And they're going to help probably 80% of the cost of it with Fresenius, and a $3,000, maybe $4,000 cap per year with DaVita. You would have to look into the specifics, but both of the larger providers in North Carolina are going to help an LPN go back to school to get his or her, don't want to be sexist, RN license. So if you're in an LPN program, don't be discouraged, because there are places for you to work. There are opportunities for you to grow and thrive in a dialysis setting. Don't think, oh, I can only work at a nursing home. Oh, I can only work here. Don't think that. Get your license, do a good job, score high, pass the test. You can get a job in a dialysis center, and the dialysis center will assist you in obtaining your RN license. LPNs are needed in dialysis. Like I said, it's going to be dependent on the Board of Nursing for the state that you live in. But it's a great license to have. It puts you it gives you a leg up on the competition. If you want an entry-level position in a dialysis setting, you're going to make more than a PCT. You're going to have room for advancement. So education you have, certifications you have, typically the more money you're going to make, and you're going to be more sought after than someone who, let's say, right off the street wants to work in dialysis. They're more or less going to want to hire you because you do have the LPN. Okay, so this video was a little shorter than my other videos, and I appreciate you taking the time to watch, and please leave comments below, especially if you live in another state other than North Carolina and you're working as an LPN. I would appreciate it if you would kind of say the setting that you work in, how long you've had your license, and some of the duties that you're able to do. Because I know it used to be years ago when you go into a hospital, you really couldn't tell who was the LPN and who was the RN. But fast forward to 2019, the Board of Nursing throughout the country have done a really excellent job with delineating the difference between an RN and an LPN. And I know in some areas they just don't hire LPNs, but oftentimes dialysis is not one of those settings. So like I said, leave a comment below if you work as an LPN in another area other than North Carolina, and kind of tell me, what you do, what's your position, and kind of how you differentiate between yourself and RN. Okay. All right. Thanks for watching this video, and leave a comment below.